Hello, my name is Kimberly DeBerry, and I'm doing my childhood issue on separation anxiety. So, what is separation anxiety disorder? Separation anxiety disorder is a type of mental health issue. In children, it's the fear of being away from their parents or caregivers, and this can start around 8 months and continue throughout their life if untreated. A little FYI, everyone kind of goes through separation anxiety at some point. Whether you grow out of it or not depends on your situation at home. Okay, symptoms of SAD in children: refusing to sleep alone, refusing to be alone, being very clingy towards their caregiver, refusing to go to play dates, school, or daycares without their parents being with them, being very worried about being away from their family and as well as their family's safety, and having nightmares about separation. Okay, so my psychological, biological, and social, these are my effects if untreated. It can cause, in psychological aspect, it can cause depression, insomnia, anxiety, stress, as well as only feeling comfortable around loved ones, a little bit antisocial to sum it up. Biologically, it can be inherited. You can, family tree wise, if one of your family members has some type of anxiety, it can trigger throughout bloodlines. It can also be due to hormone imbalance, and in the future, it could cause someone to suffer from substance abuse because they're self-medicating to aid with their problem. And socially, being poor, having poor academic performances, being very socially isolated, as well as it can cause an effect on the caregiver, parents, or the loved one's relationship. Treatment. Okay, you can go to therapy, cognitive behavioral therapy, which helps children learn how to handle their anxiety better. Play therapy, when I've actually experienced this, it's basically when you're like playing with a toy or playing with somebody or the therapist, and the kids are basically talking about how they feel. It works, but thinking back to it, I never knew that's why we were doing that activity. LOL. Counseling for the family, it can help the kid be more expressive with his or her parents about why they may be feeling or acting that way, and finding coping skills, as well as parents finding coping skills, because it's teamwork. So, yes. And then medication. Medication is only for severe cases, but you should also be doing therapy with the medication as well. And these are my references. Thank you for listening and letting me teach you about separation anxiety.